Hi, my name is Dr. Shane Howell, and this is the routine that I personally use and I recommend to my patients in regards to stabilizing my back, my pelvis, and my hips. And I do this every day. So you can do it every day or you can do it a couple times a week. Plus I get a chiropractic adjustment at least once a week when all possible. So the routine I start out with is just range of motion of my legs and my hips, and so there's different ways that you can do this. If you have a hard time stabilizing yourself, you can use a wall or a chair or something like that. But I just start out swinging my leg back nice and easy, back and forth, about a foot forward and back 10 times. So 1, 2, 3, 10 times. Then the other side. Then I go in and out 10 times. So 1, 2, 3, 4, count to 10. Same thing on the other side. Then I rotate my foot out, in, then out 10 times. Then the other side. Then I do a stretch where, if you remember from high school gym, we used to do a quad or front of the legs stretch. Just stand next to the chair or table, and I just hold it. And if you don't have stabilization problems, you put your arm above your head and hold it. What I do is hold it for 20 seconds. Just make sure I breathe. And then I do the other side. Then I do 2 sets. The next one I do, and I'll use a pillow. You want to make sure you have a nice padded floor, nice carpeted floor, or even put a couple pillows down. So, because you're going to be putting your knee down. If you cannot physically do this, just avoid this particular one. And so I'm going to, it's kind of like a lunge where my knee is on the ground. I'm going to push my hip forward. I'm going to take my same side arm up. And I'm just going to hold it for 20 seconds. And then I'm going to do the other side. Then I'm going to do it again. So 2 sets of that. Okay. Then I'm going to put my foot either on a chair or a bed, anything like that, like this. Okay. So if you need to put it a little lower, that's fine. This is really high. It's actually better if it's higher. It gets a better stretch. And what I'm going to do is take the same side arm up, and then I'm going to bend away. Make sure I breathe through all these stretches, and this one's 20 seconds too. If you can, try to reach with your opposite arm and touch the foot that's up. Hold it for 20 seconds, do the other side, then I do 2 sets. Then I essentially do the same thing with my knee on the ground. So it's essentially the same stretch, and then I come across like that. I hold it for 20 seconds, make sure I breathe. I do the other side, then I do another set of each one, 20 seconds each time. Okay? The next one I want to do is essentially kind of stretching it all the way around. The next one I do, again, you want to make sure it's padded. I'm going to put my leg like this and kind of lean into it. If you're just too tight, you may need to avoid this one. And just put my hands up like this. I hold it for 20 seconds. I do both sides. Then I do it again. An alternative way of doing that is to stand next to something, and like you're putting your ankle on your opposite knee, and then like you're going to sit down. Depending on how tight you are, you may not be able to get down very far. So this is just might be a little easier way for some people. But the further you can get down, the better. Hold it for 20 seconds. Do both sides twice. But that's the alternative, the one laying down. Next one is where I sit. Put my feet together. Everybody knows this stretch. It's stretching the inside of your thighs, called your adductors. So I'm going to kind of just lean into it, kind of keep my back straight. I'm going to take my elbows and push down. Make sure I breathe. Don't force it too much. And with this one, I hold it about 20 seconds. And then I bring my legs together and I squeeze them together as I try to pull them apart for about 3 seconds. And then I stretch it again. Same thing, okay? The next one I want to do, I'm going to bring this table up, is to stretch my calves and my hamstrings, which is the back of my leg, because those connect to your pelvis, and if those are not functioning right, it's going to restrict your pelvic motion. So you can do this on a stairs or a step or anything where it's a little bit elevated. I'm going to put the ball of my foot on that, see where you see my heel is way down there, and then I'm going to kind of walk myself forward, and I'm going to stick my hip back. It's going to hold it. So you'll feel it really tight. You'll feel the stretch through the bottom of your foot, the calf, and the hamstring. That's essentially all connected anyway. So hold it about 20 seconds. Then I do the other side, 20 seconds. And then what I do is do a few contractions of the calves and then the hamstrings, which is squeeze, like what I call them, butt kickers. And then I do it again. Keeps this nice and loose and functioning, because we sit too much and these muscles can get a little tight. Both sides. Okay. Look at my notes. Okay. Then I'm going to lie on the ground. Again, a padded floor is better. Looks like I'm going to do a sit-up. I'm going to let my legs kind of fall to the side, and you'll feel a stretch kind of on the side of the hip there. I'm going to hold it about 5 seconds. Then I'm going to do the other side, 5 seconds. Then I do it again, 5 seconds, 5 seconds. Then I straighten my legs. I'm going to take it over while I try to keep my shoulders down. You feel a little more stretch here. About 10 seconds on this one. 10 seconds on that. Then do it twice. Okay? Alright, and then there's another one for people that have a hard time getting on their knees. You gotta make sure you have a nice big pillow so it's nice and cushy on the knees. If you just can't see, just too much of an issue, just avoid this one. But it's like kneeling on your hips, and what we're gonna do is hit 4 different directions. This way, this way, this way, and this way, with kind of rotating the hips. So I'm gonna kind of pump that twice, and I'm going to do it 5 times on each side. Forward, 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 and then I'm going to do the back side. Back that way, back that way, back that way, back that way. Okay? And what that's doing is helping to mobilize the capsule, the tissue that's around the ball and socket of the hip. The next thing I want to do is kind of just a forward and back. So I'm going to kind of push my hips forward, squeeze my shoulder blades together, and kind of drive my arms down. Easy, hold that about 10 seconds. And I come down into what's called child's pose if you ever do yoga. Just lay over the top of your thighs. Do that for about 5 seconds, and I come up, and I'll do it again. Making sure I breathe through the whole time. One of the things I like to do is just kind of do like circles a few times. Looks like I'm doing a hula hoop on my knees. Of course, I stink doing hula hoops. Okay. Next one is I start to get into like the strengthening portion of what I do. And there's a little tiny muscle that comes off your pelvis onto your hip. That's real important for stabilizing things. And you have to kind of lie next to a wall or something very stable. So lie on your stomach. I'm going to put my knee up, or my leg up against the wall, and I'm going to push like I'm rotating it.
not pushing the whole leg, not the knee, more of the foot pushing down. Now hold it about 5 seconds, then pull it back for a second, then do it again. Again, I'm doing it 5 times, then I'm going to do the other side. Okay. Okay, the next one is I'm going to lie on the side. I'm going to do this on the table, so technically you can do this on your bed or on a couch, but carpet or padded floor is fine. It won't be so comfortable on a hard floor. Essentially what you do is lie on your side, just kind of support your head, keep your legs straight. Then I'm going to take my leg up about a foot or a little bit more, about 18 inches. And I'm going to, as I try to stay stable, I'm going to go forward and back about 10 times. 1, 2, 3, count to 10. I'm going to go up and back down 10 times. Okay. I'm going to rotate. See, my foot goes down, foot points up. Do that 10 times. Then I'm going to circle one way, then circle the other way. I'll warn you, it's going to start to burn because it's going to fatigue very easily. Just stop in between and start back up where you ended until you do that. So 10 times, 10 times, 10 times, 10 times circle, 10 times circle the other way. Then you do the other side. Okay? Put that down. And then I'm going to do a plank. I'm going to show you the kind of standard way, and then I'll show an easier way for people that have a hard time with planks. Okay. So I'm going to get into a plank, more of a push-up plank, so like an extended arm plank. So like this. Just make sure you're nice and straight, and you're pushing up through your back, so you're not collapsed. Okay. And from there, I'm going to just swing my leg. 10 times. 1, 2, 3, 10 times. Same thing on that side. Then I'm going to go in and out. I'm going to go in and out. And then I'm going to go rotate. It's what we call fire hydrant. Same thing on the other side. Okay? The easier way, if you have a hard time doing that one, is to put your belt, get one of these. It's called a physio ball or gymnic ball. Right about belly button level. Just lay across, put your hands down, and kind of the same thing. Count to 10. Side to side 10 times. Side to side, and then rotate. The range of motion isn't quite as good as being on your standard plank. Same thing. Okay? And then what I like to do, and this is very challenging, so might need to avoid this one. Essentially what I do is I get into a side plank position, like this, and I do the same thing as I was doing it lying. 10 times, 10 times, circle 10 times, circle 10 times. If you cannot do that, it's kind of, if you had a hard time with the one where you're just lying flat on the ground or on the bed, just focus on that one. Don't try to do this one. And the very last one, exercise I want to do is what's called a pelvic bridge. This is where we want to really isolate the glute muscles. So I'm going to lie on my back, just like I'm going to do a sit-up. Okay? So if you're a little more weak, don't have the strength in those muscles, what you want to do is just do 2 legs at a time. What I'm going to do is I'm going to lift my pelvis first, and then lift the whole thing. I'm going to hold it for a few seconds, come back down, do it again. 1, 2, 3. 1, 2, 3. I usually like to do it 10 times. The more effective way, and when you're physically able to do it, is to put one leg up. Let's try this side so you can see better. And do the same thing. Lift the pelvis and up. 1, 2, 3. 2, 3. Do it 10 times. Of course, you gotta do the other side, so it's a because our glutes function a lot of times independently. So we want to do, it's better to do both sides. Some people are a little imbalanced, so it's better to do that. But if you're not physically able, just do them there to start with. Okay. Additional things that I like to do that are really good is to use a foam roller. If you're really tight and you have kind of chronic tightness, soreness, achiness in those areas, is to do the foam roller all around. And use the foam roller kind of like doing your own massage. And I just hit every area looking for those tender spots, those achy spots, and kind of work those out. So essentially what I do, you'll be surprised, even if you don't have them there right in front of you, a lot of times you get on them, they'll be really sore, like in the internal thigh, the front. So what I do is I put the foam roller down and I put my leg over it. If I put my leg up here, it puts less pressure on it. If I take my leg up, I'm putting more pressure. And just kind of pivot around, looking for some tenderness. When I find the tenderness, I'll just hold it there for a good 15-20 seconds. Okay? Then I'll kind of work my way around. Now I'm on the side. And then I'm in the back. In the back of the pelvis where the glutes. And doing the same thing. Then I also want to do it below the hip. So this is the hamstring. Working that pelvis just below where it's connected. Okay? As well as the inside, like that. So you got to kind of really turn your leg to really hit that area. You'd be surprised at how tender that may be. So what I tell patients is that if it's significantly tender, you need to do that frequently, like even every day, really. So if you have any questions, just give me a call, 713-722-2580.